Okay, I'm going to go over ordering medications and labs in the pediatric emergency department. I'm going to go ahead and highlight my patient. I'm going to hit the order tab here. This is a safety check. Yes, this is the correct patient that I want to order stuff on. And it brings you to the order screen here. I hit orders. This is to search for orders. So let's say you want a CMP. Okay, you go ahead and click that. Notice it says one selected item now. I'll go ahead and select that CMP. And it asks who's going to order that. Usually it doesn't actually do that in the PEDS ED, so you can kind of skip that. But notice that there's one new order up here, a CMP. You want a CBC with auto diff. Go ahead and select that. Okay, if you want medications, you hit the medication tab and you can search for them here. So I'm going to go ahead and start typing in amoxicillin. Notice there's lots of different choices: amoxicillin liquid, amoxicillin. Here's amoxiclav. I want amox liquid. I'm going to go ahead and select that. And then there's further choices. It can auto calculate. Now some of these are scheduled doses, mostly for the floor. This is stat doses. So if I want amox, let's say I want 400 milligrams just to get into the child, I'll go ahead and make sure 400 milligrams PO, one dose, and I'll hit select. And then I can review my orders here. If you want to enter these orders in, you hit save down here and it'll ask for your PIN. You have another chance to review your orders to make sure that this is exactly what you want. I'll go ahead and enter my orders in. Every time I enter an order, I'll let the nurse know. I just ordered amoxicillin for this patient. I just ordered some blood work. Can we call phlebotomy, or they need an IV? Now note there's also order sets. So let's go back to order. And I can go to order sets, which have been created. Now this is the pediatrics floor, but here's the order sets that were made for the pediatrics ED that we made. So there are PEDS, FAV meds. Actually, this is going to look a little bit different in the real set. This is the test version. It has too many, but the ones that we made are called ED PEDS, pharyngitis, resuscitation has some stuff. Most of the time, you're probably going to go to ED PEDS wheezing, and then there's wheezing mild, which doesn't have as much meds. Let's go ahead and go to pediatric wheezing mild. I'm going to hit view that set. Here's the order set that I created. And here's a neb treatment. And here's albuterol, 2.5 milligrams. What you do is you go ahead and hit edit here. 2.5 milligrams. And then this is how many doses of that you want. So if you want 3 doses of that, like a pathway, go ahead and hit OK. Notice that's checked. I don't want to do, actually, usually they want you to hit neb treatment. And then ipratropium, they only have the 0.5 milligram ipratropium, so I'm going to go ahead and click that. And I want 2 doses of that. So I want 3 albuterols, 2 atrovents, and I want the kid to get some prednisone. Now this is prednisone, so I'll show you how to search for prednisolone. Or I want the child to get some dexamethasone, but I don't right now. I'll just go ahead and click those order sets, and again they will pop up as the new orders. See, these are the new orders I just ordered. I'll go ahead. Now I also want some prednisolone, so I'm going to start going in meds. I'm just going to order that by hand because that's not in our order set just yet, but it will be. So prednisolone liquid, I'll go ahead and select that, and it automatically does a 2 mg per kg dose stat, but there's no weight for the child in this test system. So I'll go ahead and put in, say, 30 milligrams PO, 1 dose syrup, 1 time dose, hit select, and now that's the order I want. I'll go ahead and hit save and type in my PIN number. You can take a look at the other order sets. I think that they're pretty helpful. Especially the surgical order set. So pediatric, so what's it called? Abdominal pain, suspect API or suspect PID. Let's see what that has in it. So you hit view, and it has some things that you might want: a CMP, a CBC, a UA, pregnancy test, amylase, lipase, CRP, coags if you need those, urine culture, blood culture, type and screen, ultrasound of the appendix, ultrasound of the complete abdomen, and then CT scan stuff. And here's your Omnipaque that they'll need. And then obviously you'll need to put in an indication. That's why it's red. That means you have to, it wants further information there. And and then there's some medications here that may be relevant. Once you choose what you want, you hit OK, and it'll pop up things that it needs. Like the ultrasound, it needs a reason. Right lower quadrant, pain and tenderness. That's starred, so that must be done. So I'll go ahead and hit OK. And again, looks like this order's already ordered. A CMP. Oh yeah, that's right, because I just ordered a CMP. So I'll just, but I still want it. Just hit confirm results if you still want that blood work. And again, here's a chance to review the new orders that you just put in. Hit save and enter. So that's ordering medications, a primer on ordering medications and order sets in the PEDS ED.